Hey guys, welcome back to Medical Coding with Blue. So, just a couple of things before I get into today's episode. The first thing is online registration for the AHIMA Conference 2019 is now officially open on the AHIMA website. That's ahima.org. If you're interested in seeing what's going to go on and available, check the website. So I won't do the countdown days because I know I promised I was not going to drive y'all nuts with that. So I will only do that on Monday like I promised before. So be sure to check back on Monday on the countdown days and how many more days that we have left until conference. So it slipped out. Whatever. It's Friday and I'm glad. And today was very productive. So the second thing was, because I had such a good response from the Q&A, like all the questions that got submitted, I kind of want to do that again. So like maybe next Tuesday, I'll answer your questions. So if you'd like to submit a question from now through the weekend and Monday, I can put together something for Tuesday and do another Q&A on Tuesday. So if you have any questions about the medical coding field, the medical coding lifestyle, because let's just be honest, sometimes it takes a very special person to be a medical coder. So if you're interested in any of those questions, just submit them and I will answer them as best as I can. Okay, so now for today's topic. So I want to do something a little bit different and address the providers that are in the audience. So I've gotten this question, or it's not even a question, sometimes I think it's more of a statement of why can't all you medical coders think the same? Okay, so interpretation is an individual thing. Yes, while we have rules that we have to follow, different people are in different times in their career. Some people are just starting out, and some people have years of experience, and some people have only experience in certain clinics. So it just depends. And I think a good way to find out where your medical coder is and where they are is to actually meet them. So I want to encourage all the providers that are watching to, if you don't know who your medical coder is, take the time to find out who they are. Sometimes in certain facilities, they have medical coders that are housed in a separate area, and you may have to do a little bit of detective work. But sometimes if you make the right place phone call, you'll be able to find out who is your medical coder. And it's important to build a good relationship with them, because keep in mind, this person or these people, whoever is doing the medical coding for your charts, is looking at your documentation. They're the ones that are deciphering what it is that you've documented, and our whole goal is to make sure that you are fully given credit for everything that you've done with your patient. So just talk to them and make sure that they understand, hey, do you have any questions? Do you have any technical questions about what I do? Or, hey, this is what I do when I'm with a patient. So sometimes through conversation, we find out things that are going on in the room that maybe are not necessarily documented, that should be documented so that you can get credit for it. I've had many instances where I've told providers, look, the only thing that I know of for sure is what you document here. I'm not in the room with you, obviously, so there's no way that I can be able to find out what's going on unless you tell me in documentation. Or if I've kind of figured it out, like what's going on, then I'll know to query. If not, I won't know to query. And which brings me into another thing. If you're getting queries from your medical coder, it's not so that we can give you a hard time or question your authority or anything. It's so that we can get clarification. So on the outpatient side of the house, there's different rules, okay? So, but on the outpatient side of the house, we can only pick up codes for what is definitive. So if you say it's possibly this or possibly that, we have to go with absolutely what did happen. What do they have? What symptoms do they have? So if you're not giving us a definitive diagnosis, we have to give you the symptoms. So, or what happened. And on the inpatient side of the house, the rules are a little different. And I don't want to go back and forth too much and be confusing. So I'm just going to talk about outpatient right now. But yeah, so it's important to kind of ask your coder to kind of gauge where they are in their career too, and find out what their knowledge base is. When I first meet a new provider, I always do this. I will go to them and I will find out what kind of exposure they've had to a medical coder. Not all medical coders do this because sometimes they don't know that they can. And it was a few years ago that I was one of those people that didn't know that I could go and build a good relationship with my providers. I really didn't. They had us housed away from the clinics that we were coding. And so we didn't have a lot of provider exposure. And it wasn't until a few years ago that I got a crash course from one of my providers that he was saying, well, I don't want a bunch of email. I really like to get to know you and build a good relationship so we can make sure that I'm getting everything, all the credit that I can. And how can I get better? And providers like that are like the best kind of provider because they want to make sure that they're documenting everything. And when you document everything that you're doing, not only do you benefit because you make sure that everything is being captured, all of your hard work, but it's also beneficial for the patient because if these records have to go to some other facility or another doctor or perhaps a specialist, at least they have the most information that they can to work with for this patient. And it's all about those details. Okay, so anytime you see us or we come over to you to ask questions, it's just so that we can try to build this good relationship. And that's something that I like to talk about on my channel a lot too, is building good relationships with your providers, because I have learned so much on a personal level for as far as my craft because of this, because I've taken the time to get to know my providers, and they've all taught me something. Even the ones that make me have to work a little bit harder, they've really taught me a lot about, you know, how to deal with providers and how to and what is it that they're actually doing, or things about their specialty. So it does make it a lot easier. Just be sure to ask your coder lots of questions. And if something's not clear to you, or if you're curious and you want to know, it's okay to ask questions. We love questions. And we're more than happy to help you, because that is part of our job, is to do training and to do education. So even though you outrank us obviously in education department, we still know how to do the deciphering of your documentation. So that's where our two crafts can marry up. So we just want to help you, and we just want to make sure that you're getting credit for everything. So if we get to know you, it becomes a lot easier and a lot more open. So yes, that's my bit of advice for today. So if you do happen to come across a medical coder that says, hey, I'm your coder and I'd like to get to know you, and let's find out what you're doing. Let's make sure that you're getting full credit for everything. It's a good thing, and you always want to make sure that you're talking to them as much as you can. And if you're not sure if you can get credit on something, ask the medical coding staff, either your designated coder, or if they have you ask a certain person, like a supervisor or maybe like a lead, make sure that you are in contact with them. So, and if it doesn't make sense, just keep asking until it does, or maybe have them explain it to you or show you something. We work off a lot of resources, coding clinics, books, articles, and so when asked, we should be able to produce a resource for you. So just keep that in mind. And what else? Yeah, I think I pretty much covered everything that I can. But if you have any questions, make sure that you ask us and let us know. You can get coding advice from your colleagues, but sometimes it may not be correct. So the best person to ask is your medical coder. Sometimes there's providers that are very well versed in medical coding because they've either gone to school for medical coding or they've learned it on their own, and that's great. But you always want to double check with your medical coder to make sure that everything lines up, because sometimes different facilities have different rules, and sometimes people operate under different mentalities because of either insurance or their facility or maybe the organization that they're with. So it's not always the same. So you always want to ask your medical coder. So, but yes, that's my video for today, and I hope you all had a great week, and I have a very busy weekend coming up, so I will be running around all this weekend, but I think it'll be very good. Hopefully we don't get too much rain. Anyway, if you are a medical coder, a medical coding student, a provider, a nurse, or just somebody curious about the world of medical coding, I hope that you will join me on my channel, and please subscribe and like if you enjoyed this video, and I will see y'all next time. Bye.